Type 2 diabetes is a chronic condition where your body's not absorbing the glucose that it needs into your cells. And glucose is a form of energy that you get in the food you eat, and your body needs that glucose absorbed into its cells to perform adequately, and also to keep it so you don't have an excess amount of glucose building up in your bloodstream. So what happens when you eat glucose, your body produces a hormone called insulin, and that insulin helps that glucose get into your bloodstream. When you have type 2 diabetes, there's a resistance to that hormone insulin, and so you're not absorbing as much of the glucose that you need into your cells, and it's just building up in your bloodstream. So you're at a higher risk for developing type 2 diabetes if you have a parent or a sibling that has type 2 diabetes. If you're female and you've had gestational diabetes, or you've had a baby that's been over 9 pounds, you're at a higher risk for developing diabetes. People that are overweight are at a higher risk for developing diabetes. And there's also some demographics of if you're African American, Hispanic, or Latino American, or American Indian, or an Alaskan Native, you're at a higher risk for diabetes. So to reduce your risk for type 2 diabetes, it's really built around a healthy lifestyle. So eating a healthy diet, a diet kind of following the My Plate guidelines, which is a diet high in fruits and vegetables, lower in fat, and a diet that's high in fiber will help reduce your risk of diabetes. Exercising is a huge part of reducing your risk for diabetes, and the recommendation is really people should be exercising a minimum of 30 minutes a day, at least 5 days a week. So if you're exercising regularly, you reduce your risk for diabetes. Another way you can reduce your risk for diabetes is if you're a smoker, to quit smoking. People that smoke actually are twice as likely to get diabetes than people who don't. And it's good to keep your alcohol intake at a moderate level, and some of that is just to keep yourself from gaining weight. Maintaining a healthy weight is also a really important part of decreasing your risk for diabetes. People that have a lot of fat stored in their abdomen are a lot higher risk for being resistant to that hormone insulin. So maintaining a healthy weight is another way to decrease your risk for diabetes.